good afternoon, or good morning, good afternoon, good evening for the participants tuning in for today's one-on-one interview with Princess Nwakego Ibrahim-Pam. My name is Princess Nwakego Ibrahim-Pam, the founder and chairperson of the Expert Professional and Business Women's Network International. It's a platform created for expatriate spouses to help them develop themselves professionally and personally. It has been in existence from 2013. It was founded in Tunisia, basically to help create a community for vulnerable expatriate spouses who travel with their husbands or wives across continents and countries. And we started this event specifically to help with leadership, with women in different leadership positions to tell their stories in their own voice to help inspire and encourage other younger women or men who are encountering the same challenges or problems in their place of work or life challenges or health challenges. And today we have a special guest of honor who happens to be my sister-in-law, and a friend who has worked in different fields in education. She's a lecturer, a professor at the Iden University in Manchester, UK. And today she's here to talk about the our what excuse
Maternal
me,
mortality, yeah,
maternal
crisis.
maternal death rate concerning childbirth. I froze there for a moment. So it's an interesting interview, and this is just to create awareness and to draw attention to the challenges and pains of childbearing experiences for women across religion, across culture, and across continents. So you're welcome, Dr. Viviane Chinwah.
Thank you, Princess Ibrahim-Pam, for inviting me for this interview. I appreciate it, and I'd like to say thank you for the opportunity and for all the great work you've been doing in your network, which I'm also a part of. So
Yes.
I'm very delighted to be here.
You're welcome. So, this interview is basically for you to tell us your story in the light of your work as a lecturer, as a mother, as a wife, and as a mentor to people around you. So, I want you to tell us a little bit about your family background, your educational background, and through your career, using the lens of being a woman leader, how your leadership have affected other women and men around. Now we have to include men because we cannot prosper in isolation from our men. So we also want to hear how your career has impacted other people, the women, the men around you, how you've been able to break the glass ceiling in your profession amongst men, how you've been able to juggle childbearing, going through your PhD and lecturing, and just the experiences of being a woman and how you've been able to achieve that to put you at this position of leadership you are now in at this time of your life. So just this is an open interview. It's all about your story.
Yeah.
You tell us what you want us to know. Anything that you're not comfortable about sharing is just okay. And then from the feedback you get from the participants, then you can follow up with those questions.
Yeah, thank you so much. My journey has been a very interesting journey. I started from the Rivers State University of Science and Technology, where I studied petroleum engineering. And I came into the UK around 2009, and my initial intention was to do a master's, maybe in the oil and gas, and go back to the oil and gas sector. That was my plan. But when I got into the UK and with some of the challenges, bringing up children, and I began to rethink. And it was as though I saw the future because I knew that my course that I've done, petroleum engineering, which I had a second class upper in, and I was very experienced and qualified in. Um, I knew somehow that it was kind of narrow. I wanted to diversify to other areas. I wanted to do other things that would give me the opportunity of being at home, caring for my children and doing other things. So it was a very challenging process for me, thinking through what to do next. And the very interesting thing is when you go online, you see all your colleagues in the oil and gas sector making all the money. And I was just at home at the time working in the healthcare sector. So I started from a very basic level, working in communities, supporting elderly people in the community and having children at the time. So I decided along the line, with the support of my husband, obviously, to look into healthcare. I never understood the impact of what I was doing at the time and the implication, but I took that leap of faith and I decided that after my master's degree, which I narrowed it down to the healthcare, and did a project related to the healthcare, I decided, okay, let me take this further and see what the healthcare has to offer. And with the support of my husband encouraging me along the way, so look into healthcare, do a PhD in healthcare management. During my PhD, this was really challenging because you can imagine I'm an engineering student. I do technical maths, engineering maths, all of the technical things, reservoir engineering. Going to look into healthcare was a different field. But I summoned up the courage to diversify and to look into healthcare and work in the healthcare sector. I began to learn bit by bit through my PhD. I read so many books. I looked at risk management. I began to narrow my research into maternal care to see what can be done. I looked at the sustainable, which was the Millennium Development Goal at the time, some of the United Nations policies and agenda to reduce maternal mortality. So I looked into that. I thought there's a problem here. I was not happy with the situation and the state of healthcare in developing countries. I wanted to make a change. So I narrowed my PhD work and I did an extensive PhD work on maternal care. I've published papers on risks, maternal risk management. I've used different approaches, models to tackle the problem. The more I dived into looking at the solution to the problem. And of course, speaking with so many experts from around the world, my heart broke. Because on one occasion, I was speaking to a health expert during my PhD work, and I remember him telling me, in my practice, I donate my own blood to transfuse patients. And it broke my heart so much. You can imagine the long hours of work. And this doctor gets to work and trying to save life. We have to sit down and take his own blood to transfuse a patient to save life. And some of the interviews I had to listen to was alarming. How women would be dropped in the hospital and their husbands would take off due to out-of-pocket payments in the healthcare system. So, I began to look deeply into how these problems can be resolved. Without going in depth, because I'm not going to go into that much later, I'm just
Yes.
introducing myself. I can get carried away because I'm very passionate about maternal care. Just to say, I'm also a mother. I've had the opportunity of having my children in the United Kingdom, and I've seen firsthand how they can treat a patient with care, love, and how we have the systems and facility to not perfect because we also have some inequalities in healthcare when it comes to Black women, even the United States and in
Yeah.
many developed countries. But I saw some difference with the way the care was administered and the support I was given, the home service I was provided with.
Yes.
Yeah, that formed the foundation of the work I'm doing today. I completed my PhD and I began my career as a lecturer. I worked diligently teaching and expanding my research. Now I am currently a chartered manager. I'm also a senior lecturer at the Irving University. I'm also leading a lot of people on my PG project, where I lead a lot of supervisors and work within my university. And I've also gone to several conferences to present my work, international and local conferences to talk about maternal care. So my journey has been interesting. It's been a
Mm,
challenging one. It took a lot of perseverance, diligence, hard work.
mm.
I cannot overemphasize the importance of hard work and diligence. A lot of people see the success, but a lot of times they don't see all the hard work that goes into that success. So
And
it's been a
sometimes
very, yeah,
disappointments,
and
sometimes
disappointment.
disappointments,
Yeah,
sometimes delay, sometimes total no,
yeah, yeah.
and
Yeah,
yeah.
yeah. And even as an immigrant, we know that there are financial challenges trying to get education, trying to get a stay in the country you are, and trying to manage all of these things together. So it took a lot from me, but I'm happy to be at this stage in life where I can not only going to learn or study right now. I'm trying to give back to the society, trying to bring enlightenment to people, trying to push for policies regarding maternal health and how we can reduce maternal mortality, especially for developing countries. And this has also led to my podcast, our Mother's Health podcast, which I've just started. And
Mm,
I'd like everyone to join in on the podcast. It's our Mother's Health podcast. Join in. And the podcast is all about sharing your stories, bringing enlightenment to the problems on maternal care and trying to provide some solution, which has been fantastic. Shooting the episode and the season has been fantastic. I had a lot of good responses from
mhm.
several consultants from around the world joining in the podcast and trying to bring solution and direction on how we can reduce maternal mortality for developing countries.
Fantastic. I'm so proud of the work you have achieved, especially being involved from the beginning, seeing you grow and where you have attained your success is so admirable and is so inspiring and is so joyful to watch your growth and to see the passion you have for communities around you because that's exactly what my passion is, serving the community. Because when you serve the community, the impact you have on the community is so, it's like sowing a seed that germinates in millions of ways you do not understand and you cannot see. So I love that very much. So I want to ask a follow-up question concerning your podcast.
Yeah.
Knowing the technological challenges that people in Africa or other underdeveloped world face. How can you create the awareness of your podcast, or how can they join and for your message to actually resonate with these people in the different parts of the world that really would need to hear this story
Yeah.
about maternal childbirth challenges and success of it.
Yeah. That's a very good question because I thought about that critically. I have different aspects of the podcast. Okay, one
Mm,
is going to be interviews with consultants where we deliberate on matters and issues and try to bring solution, profile some solutions to the problem, to bring
yes.
up because my audience is not just the women. My audience are the health experts, policymakers. We are trying to reach a wide group of people. So I have to think critically about how I'm going to present this podcast because I want the policymakers to hear us. I want health professionals to hear what we have to say. And as you know, in many developing countries, as well as in Nigeria, a lot of women are utilizing traditional birth attendants.
Hmm.
A lot of women are giving birth in faith-based premises and institutions instead of going to the hospital.
Yeah.
So it's been a problem. This has been one of the major contributors to maternal death. So how do we get this message to them? That has been something I have been thinking about critically. One
Mm.
way I want to do that is to simplify the message. And I know a lot of people on TikTok, a lot of people on Facebook. I want to use
Fantastic.
Facebook Shorts. I want to use TikTok to provide short, sharp messages out of the podcast that we are doing. I know by the time the podcast get bigger and we have more members in our community, we will be also be doing reach out, a lot of reach out to community because we have to do a lot of community engagement. We have to enlighten men, we have to reach out to the grassroots so that they understand the implication.
Yeah.
One of the podcast I just shot recently, we are talking about how to prevent postpartum hemorrhage. And I was
Mm.
listening to the health expert as he was talking, and he said there's no two ways about it. For postpartum hemorrhage to be dealt with, women must find themselves to skilled birth attendants. And they must be in the hospital itself.
Mm.
Otherwise, there's no intervention that can happen in traditional places.
Mm.
Okay, so we want to try and bring more enlightenment to women, encouraging women to take responsibility for their own health care. I remember when I had my first daughter, I was new to the UK and I was having a baby. And I remember when the doctor was asking me for my health options, and I was looking to my husband because this is what we are familiar with in our culture to make
Yeah.
these decisions for me. And I was saying, what do we do? And the doctor looked at me and said, no, I'm not talking to your husband. I am talking to you. Okay. And I quickly had a reality check. Um, reality check. Oh, yeah, this is a different society. And these things are still very common in countries like Nigeria, in a
Yeah.
lot of Asian countries, where women will have to wait for their husband to get back from work before they take themselves to the hospital. A
Mm.
lot of women have died in the process,
Mm.
or men taking decisions for women about the number of children to have, where they will have their children, and if they will undergo a cesarean section.
Mm.
Men can say, no, I don't want cesarean section. I want you to deliver like a Hebrew woman, and some
Mhm.
of these women will have to respect the order of their husbands. And so that was a reality check for me at the time. And I like more women to become bold, to take their own health in their hands, which is quite difficult. But when we begin to bring men into these discussions and forums, they begin to understand that they have to work with their wives, okay, and
Yes.
decide together the best option for how to have their babies without undermining their own preferences and choice as well.
Thank you so much. As you were talking as a linguist, it just came to my mind that in sharing information and creating awareness, how are you going to use language to help?
Um,
Because most of these women you're talking about, they are in the grassroots area, rural area where maybe they are not so educated. Um, Getting hold of the podcast cannot really reach out to them. So how would you how would you use language, ethnicity to get to these people, these women?
Unfortunately, at this point, I do not have all the infrastructure, okay, to get to different parts of the world and in different languages. But this is where I want to call on government and the policymakers to do more, to engage with people like ourselves, to begin to develop policies and agenda and build infrastructures that can help. I've been looking at some policies and frameworks for maternal care in different parts of the world that have worked. One was in Tanzania, where they use simulation training.
Mm,
Another was in Senegal, where they involved husband in education
mm,
and different part. There was one in Rwanda where they do a lot of digital alert in maternal care.
mm,
So we can't do everything, but we can work collaboratively with healthcare providers, with
Yeah.
policymakers to provide advice so that it gets to the grassroots areas and
Mm.
so that we have community impact. So for me, I'm ready to work with policymakers around the world to see what we can do. I can help to develop strategies. I can make inputs into policies that can help transform,
Mm.
maternal care in developing countries. So I think that's the way forward to work with policymakers to achieve some of these agendas.
Yeah. With your work with the policy makers and the medical personnel and all those stakeholders involved, uh, did you look at the legal implication of finding out from the medical practitioner that what would be their position to save life without having permission from the husbands if such situation arises? Would they go ahead to save the life of a woman, even if the consent of the husband provides a threat to the life of the wife?
Ideally, that's what it should be, because they have their medical ethics and practices. They should save life regardless. But a lot of times, these women, form a tight I'll call coalition with their husbands. Okay. So, for example, they could say, "I'm not going to the hospital. The doctor will not see them."
Yeah,
But uh, as much as possible, when they get to the hospital, I believe with all of the medical practice and all of the fantastic medical professionals we have
yeah.
in developing countries, we have one of the best in Nigeria. I
Mm,
believe they would do the right thing by women, but even in the news recently, I saw I saw a woman, I think it was Veronica's story. She had a baby in the local clinic and she was trying to go to the hospital and she died on her way. She tried to
mm,
go to other facilities, they wouldn't let her in. So
yeah,
it's more about money now. It's more about if they have the facilities to deal with these issues and more.
yeah,
Because I believe that once they get to those places and they have the money, but the problem is the out of pocket. Not everyone has the money
yeah,
to tackle, to pay for this type of care, especially when we're talking about a cesarean section that involved a lot of money. So is quite a lot. So those are the things we are calling on the policymakers again for how to provide universal coverage for women, provide transportation for women, how we can develop programs that will bring about collaboration between the traditional birth attendants and the faith-based institutions so they can identify risks on time and they're able to transport these women on time and make quick and fast referrals to the hospital, which is the thing we are struggling with right now because you
mm,
see many even educated women are victims of maternal death because
mm,
they are giving birth in traditional birthplaces. And, many women can't help it. That's what is available for them. They live
mm,
very far from healthcare facilities. So
mm,
that's what they have available. But if there's collaborative working to identify some of these problems on time through antenatal care visits and even the faith-based leaders, advising women to go to the hospitals to check. There should be some form of collaboration, and that is what a lot of health experts are, rooting for, that these problems are identified on time and brought into the hospitals.
yeah. Have you been in discussion with health insurance organization to see how they could cover some of these out-of-pocket expenses that will not be a deterrent for a woman who knows that her health is important, but the issue of finances is like a blocker for her to take the right decisions?
I've not been in touch with insurance companies in Nigeria, but I've spoken to health experts. I think the insurance system that they might have in place or they'll have in place in Nigeria is for skilled workers. So you
Mm,
have the farmers, the people in the grassroots that this insurance coverage does not get to. So
yes.
this is the problem. But we have some insurance for skilled birth worker. But with one of my on one of occasion when I was discussing with a health expert, he found a very clever way to help women. So what he does in his own practice is once they come for antenatal, he will help them to plan their finances in 9 months. So they begin to pay instrumentally, or he could ask them to provide maybe an item, yeah, so that when they give birth, they can sell those items and use it to pay for their medical health. So this only happens when they attend his practice. He can work out a financial plan to support these women, so that when they have children, finally give birth, then they have this money available to them. But I think these are some strategy that the government can also use, so that people can start buying insurance once they are pregnant, so
Yes.
that there's a payment plan in place. So that
Mm.
when they need a cesarean section or anything, there's money in the purse they can dip their hands into and utilize that for their treatment. But I haven't spoken to any insurance yet. I would love to interview an insurance personnel or someone that works in that sector, to
Yeah.
hear what the situation is
Yeah, to
currently
see
in.
to see the
Yeah,
kind of coverage they
yeah,
have for
yeah, yeah,
antenatal,
yeah.
delivery, and postnatal
Oh,
services for women. And then
yeah.
another thing that came to mind, which I think is one of the researches you did, the importance of cottage hospitals in rural areas. We need to keep those ones so functional that we might end up having mobile health personnel that are well trained and skilled to go to these rural areas on specific days so that even the women in the rural area knows that every Monday or every Tuesday, this doctor from the big hospital is coming and they will,
Mhm.
make themselves available to
Yeah,
have those services
yeah,
rendered to
yeah,
them. And
yeah.
from very early antenatal check-ins and testing, the doctors are able to identify which of these women are at high risk and should be told
Exactly.
from the beginning. You're not going to the native doctor's house for delivery, neither are you going to the faith-based places to have your baby. You have
Hmm.
to come to the big hospital because your life is at risk. This baby, I think with that kind of services rendered to
Yeah.
them,
Mm. Yeah.
many women now with technology, a lot of women are being aware and not in their literacy, but they are just aware that certain things no longer
Mm.
happen the way it used to happen. But still, coming back to the structure, that there is
Hmm.
no structure for them to
Yeah.
see
Yeah.
the agenda through. So
Yeah.
now that we've heard about your background. I would like the audience that are here to welcome Dr. Viviane Chinwah, who is talking to us about maternal child care issues, challenges, and successes of childbearing in developed and underdeveloped countries. So just open your mic and say welcome and thank you for sharing these wonderful stories with us.
Welcome. Thank you so much.
Thank you.
I've
Welcome,
learned.
Dr. Vivian. We've learned a lot from you.
Thank you. I'm delighted to share my
Yeah.
experience. Yeah. And
Welcome. Thank you for sharing.
yeah,
Looking
thank
forward
you.
to more.
Yes, thank you.
Yeah. So now we want to go into your career proper, and we'll be looking at your career path in the lens of breaking the glass ceiling. Like I said, it's wonderful that you're coming from a oil and gas background into the medical field. It's such a leap. There's no connection apart from the science subject that you did while you're
Yeah.
doing
Mm.
engineering program in the university. So now, how would you uh, say it has been with you working in this field that is mainly dominated by men? What has been your challenges and
Yeah. I won't say it's mainly dominated by men,
mm,
because in my institution, women are given opportunity to lead.
mm,
And I've been given an opportunity to lead, to rise in my career path, to develop myself, to train. I can just sit down and see the progress over the years.
Fantastic.
So yeah, in the United Kingdom, I know there are some glass ceilings that, of course, I want to still break a lot of glass ceilings, and I'm hoping to do so. With this podcast, I'm reaching out to global communities and getting in touch with policymakers and doing more for maternal care. So these are some of the ceilings I want to break. But regards to my career, I think in the UK, a lot has been done to break some of the gaps. There's still more to be done,
Yeah.
but I see a lot of women ahead of me in the United Kingdom that have broke a lot of ceilings. So I'm inspired by them. Even in my institution, I see a lot of women that are doing great things. I see a lot of professors in my field of area. So these are some of the things that I'm looking to accomplish and achieve. Of course, it doesn't come easy. It
Mm.
comes with a lot of hard work and diligence and contributing meaningfully to the sector. So these are all part of the things that I'm doing to get to that place. I don't think I've quite got there yet. I'm still on my way. Yes.
You
Yeah.
know,
So
there's an insatiable desire in every human being. As you
yeah,
the higher you get, the more you can see gray
yeah,
areas you want to explore and
yeah, yeah, yeah,
make it, which is that's being human. Because once you
yes.
leave your mind or yourself fallow, then you
Mm,
you fall from the knowledge or the skills you've acquired. So it's a
yeah,
good thing want to keep learning more and climbing the ladders. So
yeah.
I want you to tell us more about this podcast. What days, how often, what time, expectations, so that the audience and people who will be watching this video later on can tune in, just like we have this one-on-one interview every Wednesdays, by weekly every month. So if you can give us a routine of the podcast and also share the themes or topics we'll be discussing for the next 3 months. That would be quite interesting.
Yes, I'm currently shooting the season one of the podcast. So I'm talking about why mothers are dying in 2025. I'm looking at some of the causes of maternal mortality. So I've been shooting with a lot of health experts. We are looking at preeclampsia. We're looking at unsafe abortions in developing countries. We are looking at hemorrhage. We are looking at culture. Some of these courses, we're looking at mainly using the 3D model
Mm,
of care of delays to analyze these causes. One, delays due to health seeking behavior, women's inability to seek health on time, delays due to inability to get to the facility on time due to transportation. We are
mm,
also looking at delays due to inadequate facilities, medical facilities. Some women get to these facilities and there's not enough equipment, there's no blood in the blood bank, so they still die when they get there. So women can't even get there at all because of transport issues. And
mm.
some women are still thinking about whether they should go and utilize skilled birth attendants. So all of these we're going to be discussing in the first episode. It's going to be airing on the 29th of Friday, 29th of August. The first episode is going to be airing. You see me there talking about why women are dying. We're going to progress into seeing other health experts on the podcast discussing these issues. So it's going to be very interesting. At the end of season one, we're also going to be producing a book out of the season we've done so that it could go to far and wide.
Yeah.
And one thing I'm really proud of is these podcasts are going to be used for teaching because currently I also lecture the Masters in Public Health models and we talk
Mm,
about a lot of global health issues. So I'm
mm,
hoping that some of these podcasts and teachings and recording we use in different institutions around the world for teaching because
fantastic.
most of the health experts are talking about solutions to this problem. So it can be used for teaching and learning. And yeah, that would be my proudest achievement to get this to different institutions and university and to get in touch with many health experts around the world to come to the podcast, and most importantly, get women, these women that are facing these problems, to come and share their stories with me on the podcast so we can hear them out, to be a listening ear to these women in developing countries, to hear what is going on with them, and to see if we could help them. And like I said before, I'm not just going to end with a podcast. I'm going to do a lot of outreach work in developing countries. I want to build a community of people that are passionate about reducing maternal mortality, so that we can go to the grassroots area and see what we can do to help. Also like to mention that this is also part of the Sustainable Development Goal and Agenda.
Exactly.
The United Nations have come together to put together the Sustainable Development Goal, so that we can reduce maternal mortality to 70 lives per 100,000 live births. What the statistics says at the moment is, in developed countries like the United Kingdom, you can see it's only 10 deaths per 100,000 live births. So out of 100,000 live births, there are only 10 deaths. But you see, in developing countries like Nigeria, we have 1,000 deaths. No, in 2023, we had 260,000 deaths globally, and Nigeria accounted for a lot of those deaths. Nigeria accounts for a third of those deaths. Close to 75,000 women die yearly in Nigeria. So the maternal mortality ratio in Nigeria is close to 1,000 deaths per every 100,000 live births. So you can see why this podcast is important. You
Yeah.
can see why I'm joining my voice with different people around the globe, to reach out and to speak up against these preventable deaths, I call them, because these are preventable. Most of these causes are preventable through providing good infrastructure, education, and skill-based attendance for women in
Yeah.
developing countries. So the first episode is going to air on the 29th, and we're going to continue every Friday to produce this podcast. So that's my intention.
Yeah, just a quick question. As you were speaking, you talked about turning the podcast into literature and learning materials. Is there a way that these materials can also be used to contact governments to incorporate them into the health and science curriculum for secondary school? I think if we start from there, it will go a long way to create awareness both for the boys and for the girls who will later on become wives and husbands, and who will later on in life encounter this kind of decision making in the process of wanting to start a family.
Yeah, I think that's a fantastic idea. I'm looking for ways of collaborating with institutions in Nigeria as well, university institution, how to bring some of these teachings to curriculum, how we can support the government to bring this teaching. And yeah, that would be fantastic. That's what I am looking for, how to
Yeah,
collaborate, because healthcare is complex,
yeah,
highly complex.
yeah,
So collaborative working is really essential,
yeah.
and working with different sectors and people is paramount to reducing maternal mortality. So I'm looking for collaboration. I welcome policymakers to contact me.
Yeah.
People around the world contact me. I'm looking for people that are ready to research, ready to implement. In fact, we are tired of research now. Okay,
Mm,
we are tired. We're looking for implementation. How do we implement all the
mm,
research we've done? When I
yeah,
was researching maternal care and mortality, I saw a lot of papers published by Nigerians, by different developing countries, but are they being implemented?
mm,
So we have to start thinking about implementation. Why you see that maternal death is not applicable in many developing countries, because they are applying their research. They are
mm,
applying evidence-based studies into practice to reduce maternal care. So that's where we need to go. And it starts from teaching, education, getting these materials into books, into videos that people can watch, into discussions that can be
mm,
used to teach in institution for learning and development.
fantastic. So what what plans do you have of visiting Nigeria so that you can start building the base of collaboration? We have UBEC, which is the Universal Basic Education Council. They do a lot of the curriculum in educational system in Nigeria. We also have the Ministry of Education, the Minister of Education that you can sit down with, because if you're looking for structure in Nigeria, you have to start from the top.
Yeah.
So
Yeah.
what plans do you have in the future? Because I know right now it's just starting, but then it also be good that you start this at the same time as you're starting new, to reach out to these people so that they get to know your name recognition, follow your the content of what you're doing, the impact you're making, so that at the time when you're ready now to establish a more workable and functional collaboration with them, they know you. There's a name recognition for the work you're doing, the podcast, and for you as a person.
Yeah, I think I need more network. I need more connection in that area. So that's why I'm putting myself out there. I think one thing I've been told is that you're passionate about Nigeria. I remember interviewing one of the guests on my podcast. Like, why are you thinking so much about Nigeria? It seems your heart is in Nigeria. And I believe so. I think a part of me wants to do something in Nigeria.
Yes.
My father, may his soul rest in peace, was also a politician. He helped to develop the health center in Nigeria, in my community in Pite, in Ogoni. He helped to do works like that, contracts to build the facilities there. So I'm starting out and I'm reaching out and I'm taking myself out of my comfort zone. I'm comfortable in the UK. I am comfortable in my job, but I want
Yeah.
to do something more. I want to, because I'm not happy with the
Yeah.
situation and I want to make an impact. So I'm happy to come back to Nigeria to do something meaningful, and contribute meaningful to my society. I want to see change happen. And everyone is talking about change. And I believe that if we all put our heads together, we can make this change happen.
Yeah.
Yeah. One way or the other, gradually, we can achieve anything we put our minds to. That's what they did in the UK. That's what they're doing in their healthcare system.
Yeah.
And that's what we can do bit by bit and to take action. Unfortunately, if nothing is done, I think the death rate will still increase. I don't think we're going to achieve the sustainable development goal
Yeah.
because except we take drastic actions and measures immediately, act now. I don't see it happening. So that's why I'm putting my voices together with other voices to make sure that we make this needed and necessary change. And I
Thank
also
you.
like to mention when a mother
Yeah.
dies, women contribute significantly to the economy of any nation. Okay.
Exactly.
Women are the ones that go into petty trading. When a mother dies, the children suffer. The economy of the family is reduced. It
Yeah.
affects the children. A
Yeah.
lot of unsafe abortions and teenage pregnancies as a result of a mother's presence not there. So
Yeah.
these things touches me, and I'm looking for collaboration to see
Thank you
what we
very
can
much.
do to
Yeah.
make impact.
Elizabeth just sent a thank you
Yes.
for such an insightful session, Dr. Vivian. I have a question regarding mental health. During your research, what did you come across with regards to maternal mental health, and did you find any correlation between that and the maternal deaths?
Yes.
Fantastic question.
Yes, that's a very good question because mental health is what is on the top of many discussions. Even in every institution, we're talking about mental health. And the funny thing about the cultural implications of mental health is that women are not considered in many of this country to suffer from mental health.
Yeah.
They are, we just get on with our work. Okay.
Hmm.
I've seen a lot of Black women, especially, laugh about when they talk about mental health. So, if you tell a Black woman you
I
have
raised my hand.
mental health issues, they will laugh. They say it doesn't apply to us. Okay.
Yes,
Yeah.
no, but let me speak on that for you to understand that
Mm.
when you talk about cultural influences and background, it goes
Mm.
along. growing up as a child during our era, you cannot as much as say mental health. You've not even we were not even able to tell our parents that we are tired.
Yeah.
Do you understand?
Yeah.
Growing up is that you do your choice. You do what is expected of you. And if you
Yeah.
show any sign of reluctance or tiredness, you're being labeled like lazy,
Yes.
rebellious, and this thing. So when you grow up with that mentality, and the variables affecting childbearing is changing, the emotional triggers and variables in society is more tense and is more impactful to the child. You cannot connect with a child talking to you about mental health. And
Yeah.
so
Yeah.
the mother will say, if one good slap will shake the brain together, and so we laugh about it. But I think with a lot of connectivity uh, through technology and social media, older mothers and women who grew up in the era where you cannot complain, you cannot say you're tired. If you say you're tired, you're lazy. When you're having mental issues and you're expressing yourself, they say, oh, she's very aggressive, she's abnormal. And nobody is paying attention to the causes of that woman being so aggressive or so what's the word, spontaneous, or
Yeah. Yeah.
in her responses. So you're right, and that's the good thing about change, good thing about connectivity, globalization, exchange of knowledge and skills, changing the mindset of mothers, because mothers are the builders.
Yeah. Yeah.
If you look at any abuse in society, the mothers are the gatekeepers. And that is the honest truth,
Yeah.
because
Yeah.
of how culture has molded them. So when you see widows being abused in society, it's perpetrated by women themselves.
Yeah. Yeah.
Then you see marriages breaking down. It's mostly women impacts, So we, as older women or women who come from a different cultural perspective, we need also to change our mindset to be able to help our children, to be able to help these women now who suffer from mental health, and they see it as a taboo. They don't want to talk about it, and that
Yeah.
also helps in providing poor health
Yeah.
choices
Yeah.
for them.
Yeah. And women are expected to just get on with things. And I agree. There is definitely a correlation between our mental state and maternal deaths.
Yeah.
Because if you don't have a stable mental state, you won't make the right decision, okay, to seek the right care. So a lot of things influence our mental health.
Yeah.
And religion does,
Yeah.
our environment does, our culture does,
Yeah.
a lot of these factors does affect the way we think and reason. Like you're saying, you know, women just get along, just get on doing things. They are not expected to complain. They expect to do the cooking and cleaning a lot of times. Even when they're abused by their husbands, a lot of them may not have the voice to speak up. A lot of them have been reduced so much that they can't make simple decisions about their own health care. And if they cannot make simple decisions, even though when they know the truth, they can't still make it because they are not in the right state of mind. So
Yeah.
they make the wrong decision. They are easily influenced by things that are dangerous to their health. They are asked to go places and no, when your mental state is stable, you can make the right decisions, and
Yeah.
which will in turn lead to better outcome for the mother and the child. So mental
Yes.
health is a huge topic. I think this is something I'm going to cover extensively in the podcast as well, and getting practitioners to come and discuss some of the experiences they've seen and what can be done to improve mental health. But with everything we're doing, and we're talking directly to women out there, take care of your mental health. Take that time to rest. Take that time to reflect. You know, um, take that time to study about your own health, and don't let people decide your health for you. Don't let faith-based people, leaders to decide your own health. Don't let the traditionalists decide your own health. In
Yeah.
as much as you use these services, at the back of your mind, be able to make the right decision. Let me go to the hospital to do this test to see my state. So that's what we are empowering women with this information so they can go out there and make the right decision. And
Thank you.
all of these things also are influenced by illiteracy and poverty. Okay,
Exactly.
illiteracy, which is a huge, huge area. So financial empowerment is important as well. Education is important. It helps also with understanding information and making the right informed choice
Yeah.
for health.
And this is where we can call on our leaders that good governance is a strength to a nation, because when we have good governance, then health, education, shelter, all the basic necessity of lives that a human being needs will be met, and that reduces the stress and the mental struggles that a lot of these women, because we are the home builders. So if there is no water, there's no light, the children are sick, we don't have, it all comes down on our mental health. We become over anxious, we become PTSD. It's not just when you go to war. PTSD can happen because fear of inability to pay your bills, inability for ends to meet, inability to know what the future holds for us. So as we talk about the mental health, we're also looking at the PTSDs, and I want to connect it with suicidal thoughts. Because by the time you suffer, and we've not even touched grief in maternity, maternal childbirth issues, because it's not all pregnancy that result into live birth. So there are women who, through the loss of their children, go immediately into depression, and from depression it affects their mental health, and they now resort to suicidal tendency. So there's so much connected when we're talking about maternal childbirth issues. So there's a ripple. So if we get it right from the foundation, then we save the lives of women. We're able to educate the women. We're able to give them the structure they need. We're able to provide the transportation, the cottage hospital, the skilled and medical personnel that will help them at the different stages of pregnancy. And for me, having given birth to 5 live children and 1 vet, I know the difference. I know how important antenatal is to a pregnant woman. I know how having a good health care is important to a woman. You understand? So when you've gone through the process and you've seen the good and the bad of the process of having a child, you understand when you see other women who do not have the privileges and the advantages you have in childbearing. So this is I'm also very passionate about it, and that is why I'm so happy that we'll have this platform and this collaboration. As the chairperson and founder of the Expert Professional Business Women's Network International, and you as a member, you know the opportunity and the network that is available to you around the world. So it's something that you need to tap into. It's something that, and there's this attitude that you have to ask. People are not going or willing to just put themselves forward to be part of what you are doing. So you with the connection with the Expert Professional Business Women's Network International, go out there and ask for, we're in over 25 countries. We have medical doctors, we have psychologists, we have lawyers. So there's so many aspects of this project you've embarked on, that you have resources in the network you belong to. So I want to ask if there are other questions from the participants for Dr. Viviane Chinwah. This is a very emotional topic, very impactful. It affects every family. There's no family that is exempted from childbearing challenges. There's no family who is not involved either as a practitioner or as a benefactor or as a provider. So it's an issue that involves everybody. So if you have any questions you want her to talk on, this is the time to ask her, and then she'll be wrapping up this interview by just giving an encouragement to women, pregnant women especially, that will be listening, and then women who have lost their children, what they can do to help themselves get over the fear and the disappointment. Children, we've not even talked about children with special needs, which is also my area, you understand? So how do women who give birth to special needs children are coping? What are the medical facilities that are available in developed or underdeveloped countries of the world? So it's a huge, huge areas you've tapped into. So if there are questions, and if not, anybody with a question, okay.
I have a
So
question.
please go ahead
I
and
was
ask.
just typing it, but I would say it.
Okay.
Okay, thank you so much, Sister Vivian, Dr. Vivian. Thank you so much. I'm really inspired, and I have a handful of questions, but I will narrow it down to this particular point. So, when we say maternal death, we are referring to the death of the mother. Yes.
Yes, during childbirth.
During that birth, okay. So, when the mother dies and there is a baby that possibly might not have a family to go back to, I don't know, is there a research on, what happens after with regards to these babies?
Yeah, it's an area that I've not researched fully, but based on what I see in the United Kingdom and with many experience with some families, I think a lot of them, some children might be taken into care if there's no family member available to take on, the guardian of this child. In Nigeria, is something I like to explore. That I'll assume, I'll imagine that is the same thing that happens. It's either there's a family member to take on the guardianship of the child, or the child is taken to what they call the motherless babies homes in Nigeria. And some women do also leave their children. Abortion is a huge topic, or teenage pregnancies. These are very huge topics that are very, very sensitive. Some of these teenagers have their children and they drop them on the roadside as well. So some of
Yes.
these children are taken into maybe orphanages or some of these homes, and this is how the children are cared for, I would imagine.
Yes.
Okay.
And
Okay. Thank you so
Victoria, thank you for raising that issue. And that also leads Vivian into looking into child theft, how children who um are giving birth to and do not have family members around them. It's not all of them that end up in orphanages or homes. Some of them are stolen from the hospitals, and so we have these baby booming businesses where people, when you talk about teenage pregnancy, there are institutions in Nigeria that bring these teenagers who have this baby, and they discharge the young girls to go, and they take their babies and give it up for adoption or for whatever purpose. So these are gray areas that should be looked into if you're doing research. I know you're tired of doing research, but I think the developed world have enough research materials. I
Yeah.
think as Nigerians or as Africans or developing countries, we should also invest in researching specifically towards our own needs. Do you understand? Sometimes when these Western countries do their research, it's based on their culture, it's based on their policies and their developmental plans, strategic planning for their countries. It's not based on developing countries. They don't have us in mind. So it would be ironic or erroneous for us as a developing country to want to adapt all their researches, because it's not going to fit. It's not a project that fits every type of countries. So I think Nigerians, we still need more research into a lot of areas. We cannot compare the researches we have with what the developing worlds have done for their own countries. It's country specific. And that's a mistake we do in developing countries, where we go and adapt other people's research and try and implement it in our own countries. It will not work, because it's not specific to our own. There are basic generic aspects of the research, and that's how far it goes. But other aspects needs to be specific to the country you want to execute and implement those policies. So I think we still need much more research on very gray areas that are not looked into, maybe because they feel it's like a taboo or is an embarrassment to the nation or something. So I think you're on a good path. Well, I'm so proud of what you're doing. I'm very interested.
Thank you.
I think what Elizabeth is doing here in Nigeria and doing, is alongside of the kind of collaboration you should be looking at, because they are on ground. She's a psychologist, Doing is also a psychologist. These are people who can work with the hospitals and things like that for research, collaboration to research the impact of mental health on pregnant women. How has it led to suicidal tendency, grieving methods of women who have lost their children? What are the facilities available for them? Because grieving
Exactly.
a lost child is totally different from having a mental breakdown. So I just want to say thank you. And is there any other person that wants to ask a question, or just to say thank you to Dr. Viviane for spending this time with us and for us to be here to discuss this very interesting and impactful topic? Okay, so Dr. Viviane, if you have your last word, we want to say thank you. It's been a pleasure to interview you. It's opened my eyes to the depth of the work you do, and I'm very proud of you. And looking forward to as much support as we can give to each other in the various work we do around the world. Victoria Mazi say thank you so much, Dr. Viviane. Looking forward to the podcast. I'll be joining in too on the podcast. But you excuse me for this Friday. I'm going to be powering. So
No, it's
next
going to be recorded, so the record is going to be there
okay, yes.
to watch. So
you
you need to just try to share the podcast, so that you get, the more we share, the more it gets to the right people.
fantastic.
So yeah.
So thank you very much. Okay.
Yeah, so I've also put down the links to YouTube and to different Instagram, different social media handle there, so you can choose your preference and follow on with the discussion. For my final words, I'd like to speak to women in developing countries. Childbirth can be challenging, so take your health seriously. Be in charge and control of your own health. Do your research. For those of you in the grassroots may not understand everything I've said, maybe due to language barrier, but find a hospital, get a doctor that understands what you're doing. Don't be cajoled by religious and traditional sentiments. There's a place for religion. There's a place for tradition. Those things have their impacts. Okay, we agree with that. But there's also a place for medical care and practice. So don't mix things together. Okay, look for the next hospital. Use antenatal care. If you have symptoms, look for the nearest doctor. Okay, speak about your problem. Don't die in silence. Form groups in your local community where you can share and discuss issues and work on issues together. I'll still call on the government and policymakers to help to fight and to reduce maternal mortality, because we need to measure up. I was saddened when I saw that Nigeria was ranking the highest contributors to maternal death among all the African countries. It saddened me. Nigeria is rich in resources and rich in knowledge and skills. A lot of our doctors are doing well all over the world. We can do something. We can implement research. We can go back to the drawing board. We can work together and to make Nigeria better. And we can also help and be instrumental to helping other African countries. So this is my passion for Nigeria and for many developing countries. I hope you collaborate with me. I hope you work with me. Contact me if you have stories to share about your maternal care experiences. Go to our links. My email is OMH, our Mother's Health Podcast 92, Our Mother's Health Podcast 2025@gmail.com. Connect with me. We can do something one step at a time to reduce maternal mortality. We want to get to the level where we have at least 70 deaths per 100,000 live births. 1,000 is just too much. And these are my last words. So I'll be seeing much of everyone in my podcast. I look
Yes.
forward to shooting all the videos and bringing more knowledge and
Yes.
education on the matter. So thank you very much, Princess Ibrahim-Pam
Thank you.
Nwakego, for this opportunity and for bringing me into the network. I'm
You're
very
welcome.
delighted to be
Thank you.
here and to share my
Thank you.
knowledge.
Thank you. And I love the name of your podcast, Our Mother's Health. It cuts across gender. You know, there's no person that will call that will not have an affiliation to it. Because we all have mothers, and our mother's health is so paramount. So wonderful name, and I'm wishing you the very best. That it will be a household name. It will be a podcast that will achieve your goals. It will be a podcast that will impact so many lives. It will be a podcast that will have so many ripples across continent, not just in Nigeria or UK where you reside, but in so many countries that they don't even know who you are, but that your voice, your knowledge, your podcast will be something of a resource to each and every woman who comes across it. So thank you so much. And thank you for our audience. It's been very educative for me, and like I said, very emotional, very impactful. We're looking forward to creating mini seminars from this, so that as we do your podcast, we'll also be having some mini seminars where you just come and tell us, educate us on the possibilities, the challenges, the way forward, your plans, so that your vision can be carried along by so many people, just like you came into the network and carried my vision with you, because we need vision carriers. There's so many things we cannot do alone. They say if you go alone, you don't go far, isn't it? But if you go with so many people, you can get to the end of the tunnel, without being tired. So God bless you, and thank you so much. And thank you, everyone.
Thank you.
Bye-bye.
Yeah.
Thank
Bye-bye.
you.
Thank you, everyone.
Thank you.
Bye.
Thank you.
Bye. Thank
Bye.
you.
Everybody say